Septic or infectious arthritis, causes and treatment. Infectious arthritis, also called septic arthritis, is an infection in a joint that causes arthritis-like symptoms. It is a type of inflammatory arthritis but much more severe. Infectious arthritis occurs when bacteria or a virus enters the joint and multiplies, causing painful symptoms in and around the joint. It is essential to diagnose and treat infectious arthritis quickly to prevent joint damage and the spread of infection. Infectious arthritis usually affects just one joint, but it can also spread to other joints. Despite its name, infectious arthritis is not contagious. In this video, we look at the symptoms, causes, treatment, and recovery of infectious arthritis. Causes of infectious arthritis. Infectious arthritis is a type of arthritis that occurs when bacteria or viruses or other organisms get into the fluid between joints and multiply. People are exposed to bacteria all the time, but the immune system usually removes them from the body. However, if the bacteria enter closed areas such as the joint, they can easily multiply, causing a severe infection with inflammation and swelling. This inflammation can break down tissues in the joint, causing permanent damage of the cartilage and bone. A bacteria called Staphylococci usually causes infectious arthritis. This strain of bacteria also causes many other skin conditions. Other strains of bacteria that may cause infectious arthritis include Streptococcus, which cause strep infections, Gonococcus, which cause gonorrhea. The bacteria typically reach the joint through the bloodstream. A bacterial infection usually causes infectious arthritis, but a virus or fungus can also be responsible. Symptoms of infectious arthritis. Like other forms of arthritis, the primary symptoms of infectious arthritis are swelling, pain, and stiffness in the affected joints. Other symptoms of infectious arthritis can include pain that is more significant than in non-infectious inflammatory arthritis, a limited range of motion in the affected joint, redness or erythema, fever, which may be higher than in inflammatory arthritis, fatigue, weakness, changes in appetite, increased irritability, skin rashes. The joints most commonly affected by chronic infectious arthritis include the knee, shoulder, wrist, hip, elbow. Symptoms can appear and become severe very soon after a person has contracted the infection, sometimes within a few hours. People may also experience other symptoms depending on the organism causing the infection. Treating infectious arthritis. In most cases, symptoms will start to improve after a 1 to 2 full days of treatment. A full recovery can take several weeks, but the infection should disappear entirely. The best treatment for infectious arthritis depends on the cause. Antibiotics. If bacteria are responsible for the infection, doctors will usually prescribe antibiotics. People should take antibiotics as early as possible to reduce the risk of permanent damage. People can take antibiotics as an oral treatment over several weeks. A full course of treatment can take up to 6 to 8 weeks to complete. Some people may need to spend time in the hospital to allow continuous administration of antibiotics and to drain fluids through an IV. This treatment can last a few days or weeks, depending on the severity of their condition. Sometimes doctors can arrange for people to have IV antibiotics at home. Doctors may give high doses of antibiotics and may inject them to increase the speed at which they can start to take effect in the joint. Antifungal medication. If a fungus causes the infection, doctors will treat it with an antifungal medication instead of antibiotics. Antiviral medication. Infections caused by a virus do not respond to most treatments, usually clearing up themselves. However, doctors may use antiviral medication in some cases, such as for infections caused by hepatitis B. Draining the joint. In some cases, doctors may need to drain fluid from the joint as it contains harmful microbes. They can do this with a syringe or by a procedure called arthroscopy. This is where a doctor inserts a small tube into the affected joint through a small incision. Exercises. People with infectious arthritis can also take other measures to help reduce symptoms and prevent long-term damage. People can try physical therapy or wearing a splint from time to time to support the affected joint. However, it is essential that a person puts their joint through range of motion exercises to prevent the muscles or joints from shortening. This means they should not wear splints continuously. Complications. If people do not receive treatment early enough or in sufficient doses, there is a risk that infectious arthritis can cause permanent damage to the tissues and bones in the joint. Without any treatment, it can also cause a severe blood infection called sepsis, which can be fatal. It can also lead to an infection in the bone called osteomyelitis. How this damage impacts a person's life depends on which joints have been affected. For example, damage to a knee joint can affect a person's ability to stand or walk. However, surgery can usually treat this type of damage. Risk factors. Anyone can contract infectious arthritis, but certain factors increase the risk of developing the condition, including existing joint problems such as other forms of arthritis, an open wound, intravenous drug use, diabetes, excessive alcohol use, as alcohol suppresses the immune system, a weakened immune system, contact with non-sterilized needles, an infection elsewhere in the body.